I wanted to talk about a few more common newborn issues that might come up while you're still in the hospital or once you've been home in the first couple of days. And so one of the most common things that I'm helping my patients to manage is jaundice. Jaundice is a yellow pigment that happens to your baby's skin, and this can be quite common for children to have jaundice, but it's something that we need to pay attention to because if left untreated, it can have more serious outcomes. Although these outcomes are extremely rare and actually non-existent in Canada because we have such a great screening program for this. So all that jaundice really means is yellowing of the skin, and jaundice can happen in many reasons. It can happen in adults as well who have issues with their liver. In babies, it happens because of a chemical called bilirubin, which builds up in the bloodstream. And again, this can be a very normal thing that happens early on because babies' red blood cells produce turnover quite quickly, and we get a higher level of bilirubin building up in the bloodstream. Before you leave the hospital, we always do a check of your baby's bilirubin level. And in Chilliwack Hospital, we're able to do this with a little quick tap on the forehead. It's a little device that just takes a little picture of the baby's skin and can allow us to determine what your baby's bilirubin level is and whether it is in a safe zone to send you home or whether it's something we might have to bring you back to monitor. Sometimes we do need to send you for a little blood check to monitor the bilirubin actually in the blood, and that is typically done at the lab. And again, your primary care provider is going to get back to you with the results and help you to determine what the next steps are going to be.
So how do you prevent this? How do you prevent this from happening? Now, a lot of babies will be a little bit yellow, and that's no big deal. So you want to feed them frequently, so they're frequently peeing and pooing, so that they get rid of the bilirubin. Usually doesn't show up until about 48 hours of age. But if you notice, say you go home after 24 hours and you're home at 48 and you notice that your baby is looking quite yellow, and the whites of their eyes is really yellow, this is a red flag. So if your baby was once a very vigorous feeder and was waking every 2 to 3 hours to feed and would feed for the 20 to 30 minutes or longer, and now all of a sudden your baby is really sleepy and your baby doesn't want to wake up to feed, you need to take your baby in to get some medical attention. You go to your emergency department. The emergency department will do a simple blood test. They'll check your baby's bilirubin levels and they'll put it on a graph.
If the bilirubin level is sufficiently elevated, then we need to treat it. We need to find a way to bring it down. And the way that we eliminate bilirubin from your baby's bloodstream is to help your baby urinate, to help your baby pee out all that extra bilirubin. And the way that babies pee is to eat. And so we have to really make sure that if you're choosing to breastfeed, that it's well established. And if you're choosing to use formula, that baby is getting a sufficient amount of hydration so that baby can really pee and poo well to get rid of all that extra bilirubin. Sometimes feeding the baby isn't quite enough. And I'm sure you might have heard of these phototherapy lights. And so we use these little lights. They kind of look like little mini baby tanning salons. And we put your baby in there for a different amount of hours, depending on how high the level was, to bring that bilirubin level down. The downside of that is it does mean that you're coming back into the hospital with your baby. At that point, your primary care provider would be connecting you with one of our fantastic local pediatricians. And it usually is a relatively seamless thing to have us set up, but it does mean that you have another trip back to the hospital, usually for no more than a day, sometimes 2, so we can ensure that those levels come down to a more normal range.